And this is Houston Newsmakers Extra. We're talking with Stacey Stewart, the president and CEO of the March of Dimes. Big programs going on. The March of Dimes on the leading edge. We're trying to make sure people understand what's going on in terms of how difficult it is for some women to get the care that they need as they are dealing with their pregnancies and the inequities that are available as well. One of the things that I was reading about, and I've kind of known about it as well, I think you know my history with the March of Dimes, is there's a bias that goes on that sometimes causes some of the issues that go on. Once you get into maternal care, there's some biases that are there that have to be overcome as well. Talk about that and how some of the work that's being done to try to alleviate some of the challenges caused by that.
Well, Canberra, first of all, let me just say thank you for all that you've done with the March of Dimes and for the March of Dimes and for moms and babies. You've been a strong advocate, a board member, and you've always been on the front line of this fight for healthy moms and healthy babies. And you mentioned a very important point, which is in this country, in addition to being the most dangerous developed nation in the world in which to give birth, it's particularly true for women of color in this country, especially Black and brown women, especially when you look at African American women in this country. Black women are 3 to 4 times more likely to die as a result of pregnancy and childbirth. And we have seen a doubling of our maternal death rates in this country, whereas in other highly industrialized countries, their maternal death rates have been decreasing. Ours have doubled over the past 25 years. And the brunt has been borne by women of color in many cases. So the thing that's really interesting about that, too, is that a lot of people think, well, maybe it's low-income women that don't have access to insurance and are lacking resources, but that's not necessarily true. In fact, there are studies that show that even women of color, Black women who are highly educated with a significant income and access to all the best care in the world, still are facing a higher risk of dying as a result of pregnancy and childbirth than a white woman who has not even a high school education. So when you peel back all the layers of the onion of this problem, what we find is that at the core of it is race and ethnicity. And it really is not something we should be shocked about. In this country, we have never provided adequate, affordable, high-quality health care to all people in this country, especially to people of color, even going back to the times of slavery and Reconstruction, even until now. So because of that, we are seeing some of the results of that lack of care over generations. It is still bearing out. And the implicit bias that exists in the healthcare system is really having an incredibly deadly effect on the health of women of color, moms of color, and babies of color as well.
Don't you think when you talk about the implicit bias that goes on, one of the biggest challenges, it seems to me, is getting people who are on the front lines who may be unintentionally practicing that to challenges to get some people who are doing that to understand that it's happening so that it can be changed across the board, correct?
And that's exactly right. I mean, when we talk about whether or not there's implicit bias in the healthcare system or in any other social system for that matter, a lot of people tend to get a little bit defensive when they hear that maybe they have some implicit bias. But I'm here to tell you, I have implicit biases myself. We all do. We're all human. But what we have to do is to peel back sort of, those layers to understand if there is if we are holding any kind of implicit bias, if we're in the healthcare system and we have an implicit or unconscious bias around the people that we're serving, the patients that we're serving, people that may not have access to private insurance, or people based on where they come from, what country they come from, if that in any way is going to impact the quality of care that we provide those patients, that is just simply wrong. Mm-hmm. At the March of Dimes, we have launched a whole training program for healthcare providers, hospitals, physicians, to help us all uncover, do we have any implicit bias about anything relating to how we provide high quality care to our patients, and understand what those are and understand what actions we can take to not allow that implicit bias to come into, to become a factor in terms of providing high quality care to our patients. We've offered that to hospitals, to physicians, to healthcare providers all around the country, and it's being well received because a lot of people are now understanding, wow, if this is something that's impacting the care I provide, I need to do something about it, and I need to make sure that I am doing the best I can for any patient, irrespective of race, ethnicity, income or any other factor.
I don't want people to be confused about what we're talking about today. Some of what we're dealing with here deals with the maternity desert care. I mean, the care that's not there in some of the counties. But overall, March of Dimes continues to work overall to fight and challenge the unfortunate issues where we have prematurity, and it's still an issue affecting all women, regardless of ethnicity and color. Talk about what you are doing as an organization to continue in that fight to impact, to at least decrease the numbers that we're seeing now across the board.
Well, you raised a good point. And I think one of the things that we have to understand around this maternal and infant health crisis, there's not one reason why we are in the place that we're in with respect to really unacceptable rates of maternal death and unacceptable rates of premature birth and infant mortality in this country. We're looking at a range of different issues, access to care, with maternity care deserts and insurance. And what we find out with respect to prematurity is that the issue of whether or not babies are born too sick and too soon itself, there are a lot of underlying causes and reasons why that happens. Many of the cases have to do with the fact that the mother's health may not be where it should be in order for her to have a healthy pregnancy. And so it may be impacting not only her health, but the health of the baby. Mm-hmm. We also know there are cases of spontaneous preterm birth. And we at the March Times are doing a lot in terms of research to try to understand more about why premature birth happens, even if women are incredibly healthy and have all the access to care in the world. Mm-hmm. Sometimes it still happens. So research, advocacy to actually fund more research and get more funds so we can do more of this work, to make sure that we have programs in place like supportive pregnancy programs. These are group prenatal care programs where women get support from each other, not just from a healthcare provider, but from each other, to reduce the stress and the anxiety that they may be experiencing so they can have a healthier pregnancy. All these things are really important. And I think the last thing is we're doing is working at in a very deep way in communities, because most of the health and wellness that we experience in our lives doesn't happen in the doctor's office. It happens in how we live. It happens in terms of whether or not we have access to adequate housing, to good transportation, good paying jobs. So we're actually calling on partners all across communities, there in Houston and other cities as well, to come together, where you're a local elected official, a leader of an educational system, an employer, to come up with solutions and align around solutions that will help make sure that women are healthier and that babies are healthy as well.
Great information. We want to make sure that people can have access to this so that they can get a better sense of what's going on with the March of Dimes. And for those women who are thinking about having a child, they want to get pregnant, March of Dimes is a good place to go before they even start that process, so they can understand the best ways to have them have a great outcome. Stacey Stewart, thank you so much, President and CEO of the March of Dimes. Thank you for what you're doing, and thank you for spending the time with us today here on Newsmakers. Thank you so much.
Thank you, Canberra, for all you do.
Thank you. Houston Newsmakers Extra, your job is to share it with everybody you know. Enjoy.